भाग्यश्री रेडी आहे माझं. सरांना सांगा ती. भाग्यश्री चालू कर. स्क्रीन ऑन कर तुझी. कापडी सरांची स्क्रीन दिसते समोर. हां, त्यांना स्क्रीन शेअरिंग स्टॉप करायला सांगायला पाहिजे आधी. त्यांना स्क्रीन शेअरिंग स्टॉप करायला सांग. हॅलो. हां हां, मी आता इथं वेबिनारमध्ये आहे, जरा नंतर घेतो. हो.
Hello, sir.
Hello, sir. Good afternoon.
Good afternoon. Yes, ma'am.
करतो. त्यांना स्टॉप स्क्रीन शेअरिंग म्हणून करावं लागेल तिथं.
Occasion. With immense pleasure and a heart full of gratitude. Occasion. With immense pleasure and a heart full of gratitude, I, Miss Bhagyashri Lingayat, Assistant Professor, MES College of Nursing, Dhanekunta Lote, warmly welcome you all to this international webinar organized on the occasion of International Nurses Day 2025. We are privileged to have the presence of esteemed guests, faculty members, and enthusiastic participants with us today. I extend a warm welcome to each one of you. Every year on May 12th, the world celebrates the birth anniversary of Florence Nightingale, the founder of modern nursing. In honor of this legacy, we at MES College of Nursing proudly commemorate this date through intellectual dialogue, global sharing, and deep appreciation of the nursing profession. Now, to further guide us into the theme and purpose of today's event, I take this opportunity to invite our respected Dr. Lingaraju A.R., Professor and Head of Department of Community Health Nursing, MES College of Nursing. Sir will introduce the significance of International Nurses Day and unfold the theme of this year. Sir, I request you to kindly address the gathering.
कॅमेरा माईक पण. माईक कॅमेरा. माईक.
Good afternoon, respected principal sir, eminent speakers, respected nursing faculties, and my dear students. Today, 2025, 8th May, we are celebrating the international webinar on the occasion of International Nurses Day 2025. See, all of us, we know that the nurses are the backbone of every healthcare system, and they are one of the major healthcare professionals. Right now, in 2025, where the nurses are also facing a lot of global as well as Indian challenges. That means there is a shortage of nurses, increased workload, and other professional challenges. That is either because of increased aging population all over the world and the climatic change and even other global problems forcing the nursing professionals to hindrance their quality of care given to the patients. With the intention of this, International 2025 ICN has decided to celebrate the International Nurses Day with a theme of Our Nurses, Our Futures, Caring for Nurses Strengthen Economics. Under this theme, the ICN would like to play an important role and to focus on the strengthening the economies, improving the health systems, and even ensure the better outcomes for the communities worldwide through the strengthening the nurses, which are essential as well as part of this healthcare professions. With this short, brief introduction, I would like to welcome again all the nursing fraternities for this international webinar. Thank you so much.
Thank you so much, sir, for your valuable words and for beautifully introducing the essence of International Nurses Day 2025. Your insights have truly set a meaningful tone for today's webinar. Now, with immense excitement, we move ahead to the core part of our program, the knowledge sharing session by our esteemed speakers. Let us officially begin the webinar. It is my great honor to introduce our first distinguished speakers, Dr. Atul Kapade sir, an eminent academician, visionary Ayurvedic physician, and a leader in healthcare management. Sir is currently serving as Honorable Vice President, Rashtriya Shikshan Mandal Pune, Academic Director, Chetan Dattaji Gaikwad, Institute of Management Studies, Director of Nursing Pioneer Private Limited, and Director of Ayurveda Rasasala Foundation. With 38 years of experience in the healthcare industry and 18 years in academia, Dr. Atul sir has significantly shaped healthcare research, entrepreneurship, and strategic healthcare planning. As the founding academic director of Chetan Dattaji Gaikwad Institute of Management Studies, he has nurtured global partnership and mentored MBA postgraduates. He has also served as visiting professor in Germany at both Hanover and Lutheran universities. His role as a management consultant to Madhavbag Cardiac Center led to the development of quality HR processes across over 50 branches. He has guided Pegasus Softwares, a greenfield startup, to become India's first ERP software for the printing and packaging industry, now a multi-crore enterprise. In response to the pandemic, he founded Nursing Pioneer Private Limited, which today stands as a leading healthcare training and placement company with over 50 international placements in Europe in 2024. We are privileged by your presence today. Sir, kindly grace us with your address. Sir, please take over the session.
Thank you very much, ma'am, for giving this opportunity. I hope, am I audible?
Sound nahi aata hai.
Yes, sir, you are audible.
Yes, sir.
Okay, thank you. Good afternoon all.
Nahi hote.
Thank you, Bhagyashree ma'am, for introducing me in detail. Yes, it's a very special occasion, particularly International Nursing Day on the 12th of
स्पीकरचा साऊंड वाढव.
May every year. We celebrate this as a Nursing Day. It's not just one day on the calendar. Actually, it's a salute to a lot of resilience, a lot of what you can say, the empathy, a lot of hard work, and so many other factors which actually are commitment, we can say, which is actually responsible for means nursing community. On this occasion, this year's theme is very interesting, and with this theme actually we would like to go ahead if just let me know if you can see my slideshows, then means we can get started. Okay. Is it visible?
No, sir.
Okay, just give me a second again.
Sir,
Yeah.
not visible, sir.
Okay. Can you open from your side? Can you?
Yes. Sir, yes, sir.
Okay. You can share the screen still because you have the presentation. I can speak. That's fine.
Okay, sir. Wait a minute, sir.
माझ्यात रिक्वेस्ट ॲक्सेस करायला लागते, माझ्यात ती होत नाही ओपन. तुझ्याकडे डाउनलोड केलेली आहे का?
Okay. Until the screen is shared, let's give a little background of this talk. What we are actually going to see now is particularly it is more related with, you can say, that this year's theme. That is what you can say is our nurses, our future, caring for nurses strengthens economies. Yes, it's a very what you can say appropriate title or a theme which International Nursing Council has introduced this year, and for this particularly means this concept, actually what we would like to discuss today is, first of all, of course, what do you mean by caring for our nurses and why it should be such an important aspect. So caring for nurses is our first topic. Why and how are the answers. And yes, all of us are well aware. I am also medical practitioner for a long time. So I have seen hospitals, I have set up hospitals, I have set up many quality control systems in many hospitals which are NMH accredited now. So at that time, it is means everywhere we have found in domestic part also that it is means nursing or paramedical. I will take all the paramedicals into the same bucket, and they are not given that much importance as they should be given, because actually you people are the front line soldiers who are actually having all the responsibilities. So it is something which is very important task, and for that we have to take care of this community. And if we don't take care of this community, the economic impact is on the negative side. And if we take care of this community, the economic impact will be on the positive side. So that is the first part which we will like to see. And in that context, there are certain themes or strategic points which have been introduced by INC this year. And in the same context, I have kept some presentation pertaining to one particular European country called Germany, where I'm well exposed to last almost now 12 years, 13 years. So, lot of opportunities to go to Germany, teach there, mix with the community, meet many nurses over there. I have seen, means I have talked with many nurses which are migrated from many other countries like African countries, Philippines, then Eastern European countries. Those who have migrated and what challenges they face, what intercultural challenges they face, at the same time, why they choose international careers. So all these aspects we are going to see in this a quick presentation, and mm, that is something there is a means a way out that how we can take care of this particular means community. Okay, so as we are well aware that it is something what we call as a means birth anniversary of Florence Nightingale, and yeah, thank you, ma'am. Yeah, you can come to the next slide. Yes, we were talking about this topic, that what I'm going to explain, and it is particularly, yes, caring for our nurses, why and how, what is the ground reality, and what is the economic impact of nurses community, and why these international opportunities are important, and some examples I have kept from one country and their systems and how they are taking care of this nursing community. This is what I'm going to talk about. And if you have any questions, any queries, any thoughts, we can keep around 5 minutes at the end for any Q&A sessions. Next slide, please. Yeah. So it's a all of us are well aware that it is a birth anniversary of Florence Nightingale, who was founder of modern medicine, modern nursing, since the war times, and all those things are well known to you. So I'm not going to repeat those things because you people are from the same community. But I would like to take this privilege to wish you means a very happy nursing day, International Nursing Day, and yes, would like to means assure you that there are people across globe who are ready to take care of this community, and it means taking care of their. I have seen so many examples. I will talk about even the health side, physical health, mental health, burnout, stress. All these are present issues of means nursing community across the globe. It is not only in India or somewhere only means in particular country. Okay, so that is something which is there, and then there is a this year's focus is on health and well-being of nurses. So when we talk about health and well-being of nurses, we have to take care of their physical health, mental health, even the financial health also. So all this we have to means take care when we talk about the caring for nursing community, and we know the critical role. And if we take good care of this community, there can be three outcomes which are mentioned. Like automatically we can strengthen the economy because it's a huge number community. It's not like a minority community. It's a big number community, and healthcare field is expanding every day. Even in India, it is now getting more and more organized. So for getting organized this field, it's a efforts. Government has also given a lot of push to quality control systems, accreditations, and what should be the norms and all those things. That is, these are also initiatives by which actually a lot of human integrity, human dignity, all these aspects are actually means maintained. Okay. So considering this, what we can see that there is another important outcome is improving the health system. That is what Indian government is trying to do since last few years. And outcome is ensuring the better communities. Means if these communities are good, they are having good health, they are having good means physical health, mental health, financial health, they are not burnt out, automatically they can contribute more and better care can be taken of the communities. Next slide, please. Yes. Actually, what are the big challenges? Even in the INC's report this year, you will find the same challenges are mentioned. Let's talk a little bit about these challenges so we can talk more about the solutions also. The first and foremost challenge is chronic understaffing. It means everywhere. You go to any country, there is a shortage of nurses. Literally, means I have talked with people in USA, I have talked in Canada, Australia, New Zealand, means Germany, Spain, UK, Ireland. Literally name the country and there is a nursing shortage. So it is something which is a universal phenomenon. It is not only in India that we are understaffed. And that's why actually role of academic institutions, all nursing colleges is really pivotal. It is something which is going to help all further means what we can say the generations to come, and they can get a good quality healthcare support with the nursing community. So for that we have to solve this means issue of staffing, and because of means understaffing, naturally there are burnouts, lot of means extra duties are there, and unfortunately in India even you do the overtime, whatever the payouts are given, already the salaries given to the nurses, I think in the government sector it's reasonably well, but in private sector now the accredited hospitals or institutions, large corporate hospitals, they are trying to compensate comparatively better. But at the same time, means there are many private sectors, means organized there, this hospital sector or healthcare sector is divided into two parts. One is an organized one, another is an unorganized one. If you take the example of India itself, it is almost, I can say 80% is unorganized sector, and hardly 20% is organized, like corporate hospitals and their turnovers, their patients, their facilities, and how many patients are taking treatments into this. If this data is collected and interpreted, you will find that only 20% of the population gets benefited with corporate hospitals, and 80% population gets benefited with small, medium scale hospitals or government hospitals. Okay, so that's why this problem is universal, even in India and across the globe also. Then unsafe working conditions, this is a big issue. I think today's audience is most of us are from Maharashtra state. So recently also you must have seen in the media, newspaper about some gynec mishap in the hospital and what were the means public reaction and unnecessary lot of things were there. I'm not commenting on any legal issues over here, what is correct or whether treatment plan was correct or not. That is not my intention, because it's a legal matter, so we should not discuss also. But at the same time, the public reactions, many times the violence is very much seen. Workplace violence is something which has to be avoided. And for that means our patients also have to be educated, because relatives are not educated, patients are not educated, and I'm talking about the literacy in the healthcare sector. I'm not talking about whether they are graduates, undergraduates, postgraduates, because uh, means many of Indian now population is at least 10 pass, 12 pass. So that much means they have the education. But like what we when we say the literacy, so health literacy is also equally important. And unfortunately, in India, there are a lot of superstitions, lot of other things, not many scientific things, and more followed methods are traditional, conventional, which actually lead to many complications and unnecessary conflict situations between hospital staff and patients and relatives. So actually, the duty place is very important. It's a sacred place, but unfortunately, the norm systems in the system where maximum patients take care or take advantage of the system, it's not there. So it has to be actually done. And for that, even shifts have to be very comfortable. It means if the night shifts are there, hardly there is any provision if somebody is staying away from means hospital premises, right? So considering this, we have to understand that what is this particularly means unsafe working conditions are. We are aware. So hygiene. Now we have seen that in the time of COVID, a lot of means paramedical forces, they have to get exposed to the infection. So hospitals have to take care of their staff first. Then they should take care of the patients, because we are the major stakeholders in the healthcare systems. Nurses are the major stakeholders, and the due respect, due credits should be given to them, because they are with the patients, with the relatives most of the time. We doctors means we just give the orders and we move on. But all the time, 24/7, the patients are handled in the hospitals by means nurses. So it is very important that there has to be a good workplace, quality workplace. Shift timing should be reasonably well, understandable, and the hygiene of the staff also should be well maintained. The next challenge is, of course, inadequate pay. Means there is a vast difference between private sector and government sector's jobs. All of you are well aware, so I should not much talk about it. Even for the academic staff also, I know that there are a lot of limitations to the means many colleges, many institutions. I am also responsible for running the institutions. So from management side, we know what are the problem areas to give the high salaries. At the same time, means there are problems on both sides, because the adequate salaries are not there. Then naturally there will be attrition. People will leave the place and go to the somewhere where even if it is a difference of 1,000 rupees, 2,000 rupees in a monthly salary, people leave. Not only that, migration also happens because of marriages, because of transfers, because of so many other things. So these are big challenges by which actually the workforce is limited, and they get a lot of issues because of this. Because of inadequate staffing, burnout issue already we discussed, so I will not repeat it. And most important part, last, where I see more as patients, as a growing challenge of lifestyle disorders in the society. It means if society is facing, at present we say the India is the world capital of diabetes. It is almost becoming, means now soon within 5 years probably we will declare. Earlier it was our country was known for tuberculosis. It was known for anemia. It was known for even HIV spread. But nowadays, means other than the communicable diseases, non-communicable diseases also are at rank, right? So hypertension, cardiac disorders, diabetes. This is something means our staff is not, they are not immune from this. They are not immune from this, and at the same time, because their hectic schedules, they are not keeping themselves healthy. It is not possible to do 8 hours, 10 hours, 12 hours duty and then try to keep yourself fit also. Means ideally every person should spare at least 1 to 2 hours for physical fitness. And I mean physical and mental fitness. Means you should do some walking or some aerobic exercise, some cardio exercise, some weightlifting, some whatever. Means for girls it is like a Zumba, dance, whatever you do. At the same time, there should be a pranayam practice, meditation, and all those like mental health means should be also managed. But the community which is serving the community itself is suffering from this. I can give you n number of examples. I know that time will be limited for me because we have started little late. So, but one or two examples I would like to quote over here. That already in the introduction, Bhageshri ma'am told all of you that actually we are a company which is means Nursing Pioneer is a company which actually trains, develops, recruits and places Indian nurses into the foreign countries. So in this context, actually when our candidates get selected and when the visa process and everything has to be started, before that it is mandatory by European countries to get the health testings, in which there are health tests like a tuberculosis, like CBCSR, anemia testing, then liver function tests are there, hepatitis A, hepatitis B has to be tested, then there are even measles and mumps, means your immunity has to be tested. So these are primary things, and what I have observed in last 2 years, while sending these 50 plus nurses into the Germany last year, that there we found out surprisingly, almost I can say 50% or more our nurses are anemic. There, if I say average hemoglobin levels are not even 10 or 12. So it means our community has to be anemic. And that's why they are malnourished. That's why they are not having the enough strength to do the duties. So nutrition is very, very major role it has to play. We have to talk about it separately, not in these sessions, but how it can play the roles, how you can take care of yourself. So, because I have found even hepatitis B patients, I have found tuberculosis positive patients, I have found measles, there is no antibodies against measles. So it means we have to re-immunize the person. We have to give the AKT, anticox treatment for few months. Until then, we could not send these candidates. So it means if we screen, then only actually we can do something about it. So we have to taking when we talk about the taking care of this community, automatically it is something that a healthy community will strengthen the economy. So this is a point which I wanted to express through this slide. Next, please, ma'am. Can you change the slide? Hello? Yeah. I think strategy is correct. This is the strategy. Thank you. So again, these 7 strategies are suggested by International Nursing Council in this year. It is from your report only. I have just made the bullet points. because limited time is there. So what is the plan of means INC is suggesting ensure adequate staffing and skill mix for adequate care. This is very important, skill mix, because what happens that corporate hospitals are not ready to take freshers, and because freshers are not getting opportunities many times, then what happens that they are not well trained. When they become, if they are trained in some small hospitals, then that training is not sufficient. So actually we have to, even skill enhancement trainings should be part of our syllabus, which I know that nowadays it has been introduced. But skill, what type of skills is another question. There are not only soft skills, there are technical skills, there are communication skills, there are nursing skills, there are interpersonal skills. So many types of skills are there, and those skills have to be taught to our students. Then only they can become a confident human beings. Okay. Then of course we have to invest into the right equipments and resources. Means today we don't have that much time. Otherwise I would have shown few equipments used into the German nursing homes or hospitals. Literally means so much care is taken with the help of equipments that you don't have to lift even a heavy person. Means instruments can lift the person. Means patient can be lifted from the bed to the chair or to the stretcher, and from stretcher to the chair, then that chair can be moved and you can go to any place, anywhere. So all these things, how many hospitals have infrastructure like that in which we can move the patients from anywhere, anytime on wheelchairs or on stretchers? Only in corporate hospitals. Otherwise, it is very difficult even bringing down the patient from one floor to another. What difficulties we face, I have seen. So all of you are aware about this. So we have to invest in the right equipments. We have to invest in human resources who can train our young nurses. Then we have to provide a safe and decent working conditions. How are the working conditions in many hospitals again is a point of debate. At least means we should have, because majority of nursing community is a female community. So we have to take care of their special needs. There should be a good, clean, hygienic toilet should be there. Then there should be sanitary pad disposers and all those things, means small incinerators for disposing these, and so many things. So many things. So you can't expect just like they should come and means do the whatever the hectic duty every day. Means whenever there is a time of a menses, at that time you have to consider that particular female nurse. You have to give her rest, or at least means give her a light duty where she can do it correctly. If somebody is, there are many even students, young students, nursing students, or pass out nurses. I have seen female nurses who are suffering from PCOD. So if you are having a polycystic ovarian disease, automatically your menses is painful. It is irregular. It is having so many other issues. So it means, again, your care has to be taken by the community. So it is not only about means you have to invest in the equipments, we have to invest into the resources. How many hospitals are keeping time free or checking up our staff? Probably only once in a year, just like Indian corporates. Ideally, it should be every month, but nobody gives that much importance to it. So we have to provide the safe and decent working conditions. We have to support for the educational and professional development. That's why I mentioned the skill enhancements. So even on duty also, we have to improve the skills of these people. Then we have to, of course, build a quality organizational culture. It's a good initiative by Indian government, even for the small hospitals, to enter into the means entry level of any page. Because of that, they have to make so many improvements into their existing system, which automatically helps means professional development and support system for nursing community. So this should be done. This should be mandatory for each and every setup. Then we have to improve the access to the healthcare of nurses. I have already talked about this point, so we'll not repeat again that we have to investigate them. We have to give them guidance. We have to give them counseling. We have to give them some time for their leisure time for fitness. We have to give like a gym passes. If you go to corporate, there is a gym memberships are provided freely. Means corporates pay for their gym membership. I haven't seen any hospitals, at least up to my knowledge, who are doing such type of things for nursing community. There may be few, but I am not aware. If somebody is doing, very well appreciated. But if not, this is something they have to get started. So all these, and along with that, we have to give the very, very fair compensation. And all these strategies. Yes. So when we talk about the caring for nurses, there are so many, means you can see the list 1, 2, 3, 4, 5, 6, 7, almost 7 points are there. We have to improve the work environment. We have to give the financial benefits. We have to give the good leave policies. We have to have the gender equality everywhere. Human respect should be, human dignity should be there. And we have to show them the career growths, career paths, and social benefits also, like pension, then all other provident funds, and so many other social means insurance, healthcare insurance, family insurance. All these should be taken care. So how it is taken care in other countries, that is what we are going to see. So I have kept that one case study. So all these points will be repeated again. So we can move to the next point also. Next slide, please. Yeah. If we see the ground realities, we have already seen that means there is a difference between the private and public careers. Then there are means always issues of security for private in the private hospitals. Insecurity is about jobs. Insecurity is about payments. Insecurity is about career growth. Correct. So there is no mapping, like what type of mapping is there. So such type of mapping for means how the growth should be there, how the career should grow. All these things are not done. Nowadays, many hospitals provide the trainings. That is a good thing, but it has to be done on a higher scales. And quality control issues also I have talked about, because I have actually consulted many big hospitals, corporate hospitals, for setting up their NA-based systems. At that time, I have seen so many lacunas. Documentation is very much lacking everywhere. So these realities, all of you are aware. I am also aware. I am from the same community. So we have to address all these things. That is what a caring means for this community. Next, please. Yeah. Now, quickly, I will go through the case study of Germany, so that, ma'am, exactly how much time I have? So that, because we have started, and you don't know when we have started. 12:30? At what time we have started? Can I get means 10 minutes or 5 minutes or 15 minutes? What?
Sir,
how much time is?
Sir, 10 minutes more.
Okay, no problem. No problem. Thank you. Thank you. Okay, so I'm just going to present a small case study of Germany in front of you and how they are taking care. Okay. You can see this is an old photo of mine, almost 12 years back. So it's from the German railway station of Hanover. And next, please. Yeah. This is, okay, I'm just going to show you 3 such buildings. I have just given the names of the cities over there. This is the one set up from one city called Hamburg. It is on the northern side of Germany. Next, please. You can see it is called as Neustadt. It is on the coastal side. Germany also has some sea-facing areas, so you can see the premises. Next, please. This is from Hanover, where I had already gone multiple times. So, next, please. Yeah, this is bad trend. If you see these buildings, what it comes, does it look like apartments? Does it look like some hotels? Or it looks like something else? But it is nothing but these are different types of nursing homes in Germany. So you can see what is the infrastructure. Just a glimpse of few photos. That's it. I think means pictures tell more story than description. So I have just put 3-4 photos into this. Next, please. Yeah, I think all of nursing candidates, they have these skills. If our nursing candidates, young candidates, are having a situational awareness, mindfulness, they are alert, adjustable, resourceful, and technology savvy, what we call as a smart, and they have nursing skills, understanding the nature, resilient, they have good soft skills and empathy. That defines the nurse. So smart nurse, if you have these skills, you are eligible for any international job. Okay, and that's why these skills I have mentioned. Next, please. Yes, this is interesting. That if we compare the career options in India and abroad, particularly in Germany, in India and Asian countries, what are the options? One, you can do the PG. One, you can go to the job. Third is we can go to the academics. And fourth, we can go to some hospitals, right? So in Germany, you can go to the nursing homes. You can go to the old age homes. Again, nursing home is not small entity. It is normally 100 bedded, 200 bedded, 150 bedded setups where people are staying and nurses take care of these people 24/7. And doctors only visit once a week. Rest everything. Nurses are doctors over there. They are like superintendents, they are RMOs, everything is taken care by nurses. So nursing homes are there, old age homes are there, hospitals are there, even daycare and schools, they appoint nurses. Then industrial health facilities in India also we get nowadays, but very few opportunities are there. Then for post-graduation, you can enroll for a free education. You can enter into the research community. You can go to the pharmaceutical industry. You can enter into the clinical trial industry. So many career options are there. I think many of these options are easily possible in India. Some have recently started, but we have to implement them more. That is what I would like to mention over here. Next, please. Okay. Now, a quick glance at the Germany's population. If you see from this graph, actually the average population, you can find out it is somewhere here in between 50 to 60. Peak is 57, 58 or 56, something like that. So actually it's an aging country, and that's why they need around 5 lakh nurses in next 5 to 10 years. So that is a huge, means no country is producing this much nurses. And each and every nurse, even if wants to go to Germany, practically that is not possible, right? So physical infrastructure they are providing well, but there are many migrating nurses like Indians, Mexicans, Filipino, Brazilians, Vietnamese, Africans. All these are coming to Germany because they are giving a high-paid salary jobs. Next, please. Yeah. This is what we were talking about, the work culture or work environment. There, 5 days a week is there. So strictly 2 days are completely off. Means if you can compare with Indian scenario, I don't have to talk about it. We don't have that much time. 8-hour shift is there. Anything above 8 hours, there is an extra payment. If you work on weekends, extra payment. If you work on any public holidays, you get extra payment. If you work in the night duties, extra payment. If you means literally all these things are not part of the salary, they are extra. So minimum job space because you are taking care of hardly 5 to 10 people. If we see, there are nurses in many hospitals I have seen in India, one or two nurses taking care of more than 50 patients. So here only 5 to 10 people you have to take care, which is less stressful job. Then dignity and ethics is followed very much, and they are treated just like any equal means any equal professions. And fresher also are paid very excellently, and actually you have to means attend very limited number of patients. Okay, this is a work culture, and yeah, I this is a photograph taken in Berlin long time back by me, so it's very scenic countries are there, scenic cities are there. Next slide, please. Click one more time. One more. One more. Yeah. Thank you. If you see, can you click one more time? I will try to. No. Go to back last slide. Yeah. Thank you. See, what is the salary or entry level salary? Actually, it is 2932 rupees. That is around 3000 euros. Now, yesterday's the euros rate was 96 rupees point something. So you can see that roughly take home salary, gross salary is around 3 lakh rupees. Okay. And with the experience, automatically salary gets increased through collective negotiation. You don't have to go to HR, you don't have to go to any person or ask him to raise the salary. And there is no difference between public and private sector. Everyone has to pay this salary. So that is part of there. Next, please. One more. Okay. One more. Yeah, correct. Right. Thank you. You can see that I can explain quickly that 2932 is your gross salary. Brutto is that is means before tax, and netto is net salary, that is after tax. So around means new nurses also get around 1,82,112 rupees take home salary. Take home salary. And all other around 500 euros you get extra. So around 40,000-50,000 you get extra. So that is different. I am not talking about that. But straight away means on average you get a take home salary of more than 2 lakhs. Even if the European countries are costly, living cost is not above 70,000-80,000 per person. So every month nurses can save around 1 lakh rupees, which is not possible in India even for doctors. Forget about nurses. Next slide, please. Yes, already I have mentioned that. Okay. So what other benefits are there? Yes, you get the confirmed job assignment, then cost of relocation is taken care, flight cost is taken care, initial stay price taken care, dependent family also can be shifted after 2-3 years. Then medical care for yourself is completely free. And education for kids, if you go there and then have the kid, then the education for that kid is completely free. So that is racial bias is not there. Contracts comes initially for 1 to 3 years, then it can be extended. So you get unlimited contracts also. You can work until the age of 67. That is a big means span you have over there. And if you stay there until the age of 67, you are applicable. Even Indians are applicable for pension schemes. Next slide, please. Yeah, even you can go through for the further studies also. So there are many courses, part-time courses, full-time courses, and employers also support for this. So that is something which easily is possible in Japan. Next. Next slide. Okay. So actually, I have just given you some examples, and I have kept deliberately one photograph over here. Her name is with me. You can see her name is Ina Schwenwater Kramer, and she is a CEO of one company, big company, a nursing homes. They have around, I think, 47 nursing homes are there, and she is the chief executive officer. And photo is not here because she is the chief CEO of that company, but photo is here because she has started her career as a nurse. She is just like a graduate like yours. Not only that, her internship she has done in India and in Maharashtra at Shegao. So she has stayed 20 years, almost 40 plus now, but she has stayed in her young age in India for internships in this primary hospital of Shegao. So you can understand how much dedicated these people are.
No problem.
And with that, now she is almost last 5 years, she is the CEO of this company. So you can understand that nurses, if given opportunities, then they can be easily actually grow their careers. They can fly off, and that's what actually it means to be. And means particularly when we talk about uh, taking care of our nurses, taking care of our communities, and making the economic impacts also. Because if you see the salary structures and all those things, what we can understand that if you are well paid and you are not stressed with your workloads, automatically you will take care of that. Means no one can believe that she is, it means must be around 45 plus, but absolutely looks very, very younger than that. Because she is a marathon runner, and she is again another, she is international player in the archery also. So I asked her so many times. She's a good friend of mine because we have given a lot of candidates to this her company. That how you can maintain all this. So she said that on weekends, every weekend, we just freak out. We just spend whole time in the nature, in the sports, with the family, with the friends. So it means relaxing, rewinding is also equally important if we expect a good health from our community. So taking care is something which already we tried to explore how it can make impact if some nurses choose like the international careers, and almost pay structures are everywhere similar. If you can go to any European countries, it is almost similar. Only thing there are some minor differences. In today's topic, we are not discuss that because that is not the intention. Intention is through the case study of Germany, how we can learn that how they are taking care of their community, and can we take some good lessons out of it and implement it into our healthcare systems. I hope the time what has been provided to me, you get some quick insights into this topic. And with this, I would like to thank again means MES College of Nursing, Professor Kare sir, and all his team members, Bhagyashree ma'am, everyone, whoever is responsible for bringing me over here. And already, like means I would like to say my really heartfelt thanks to everyone for attending this part. If you have any doubts, any queries, if we have time, I can answer it. If we don't have time, because I think the next speaker must be waiting also. So it's up to the means you people over there who are handling this. So with that, I would like to say thank you and take care, and means be a strong community. For that, if anything can be done from me, from my company, I am always means there for you. Feel free to be in touch with me. Thank you. Thank
Thank
you.
you, sir, for your valuable guidance.
Thank you so much, sir, for your insightful and thought provoking session. Your words have truly shed light on the importance of caring for our nurses understanding the economic impact of the nursing community, and learning from global examples like Germany. You have also inspired us by highlighting the international opportunities available for our nursing professionals. Your message has not only enlightened us but also motivated us to look at nursing from a broader global perspective, where our roles are not limited to caregiving but also extend to leadership and reform. Thank you so much, sir, for sharing your valuable time and knowledge with us. So, if anyone asks question, then please unmute and ask the question.
Yes. Or they can chat also if you can give me the whatever.
Oh, okay, sir. Okay, if any of our online participants have questions for the speaker, you may kindly type them in the chat box. Dr. Madli ma'am has left a remarkable imprint on nursing education and practice. To highlight a few her countless achievements, ma'am has published over 40 original research papers in reputed national and international journals. Ma'am is also the author of two books, one on radiation-induced mucositis and another on infection control, and has contributed a chapter on antiretroviral drugs, also earning two prestigious international awards for her research. For her commitment to nurturing future nursing professionals. Her role as a reviewer, where she received a certificate of excellence for her contribution to academic publishing, further reflects her commitment to scholarly excellence. As a chairperson, organizer, and
in various academic events at both national and international platform, she has demonstrated exceptional leadership. Dr. Madli ma'am has also served on the Board of Studies and Academic Council of two reputed universities, shaping the future of nursing education. Ma'am has successfully guided postgraduate and led community-based projects with funding, proving her strong grounding in evidence-based practice and community services.
You are connected loss. स्क्रीन आणि हे बंद कर कॅमेरा.
Sorry for interrupt. Okay. So Dr. Madli ma'am has also served on the Board of Studies and Academic Council of two reputed universities, shaping the future of nursing education. Ma'am has successfully guided postgraduate research and led community-based projects with funding, proving her strong grounding in evidence-based practice and community services. Dr. Milka Madli ma'am continues to inspire with her dedication, discipline, and deep-rooted passion for nursing education and research. We are privileged by your presence today. Ma'am, kindly grace us with your address. So please take over the session, ma'am.
Hello, can you hear me?
Yes, ma'am.
Hello,
Yes, ma'am.
can you hear me now?
Yes, we can hear you clearly now, ma'am.
My PPT should be there.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yeah, my PPT has not come so far. I'm waiting for it. Yeah, I'm sharing. I'm sharing. Hello, I'm sharing.
Yes, ma'am.
Yes, ma'am.
I'm sharing.
Okay, ma'am. But your screen is not visible
Yeah,
yet,
it's
ma'am.
not come still. It's not. Yeah, it's not visible. I know. Yeah. Just a minute.
Mic. हो प्रेझेंट करून ठेवलेली आहे. नर्सिंग फाउंडेशन लॅबमध्ये आहेत काय?
I'll get them to share. Okay, can you share from your side?
Nursing department. Just wait. Where is this? Medicine deals.
I think it is coming. Nothing. Okay, share from my side. Hello? Hello?
हाँ मैम.
Hello? Can you share from your side? Hello? Can you share it from your side, please? Yeah.
Okay. Wait a minute, ma'am.
Yeah.
Is it visible, ma'am?
Yeah.
Okay.
Yes. Working? Okay. First slide, please. First slide. This is second slide. Yeah. So shall I start?
Yes, ma'am.
Yeah. Okay. Good afternoon, everyone. And it's my privilege to talk on this platform. And glad to see you all in good number. And at the outset, I would like to sincerely thank Mr. Milind Kale, principal of this MES college, and all the organizing committee for giving me privilege to speak on this auspicious occasion. And happy International Nurses Day. You are true heroes, and I will applaud for each other. Next slide, please. Yeah, my talk will be focused on few of the points like what contribution has made by Florence Nightingale and what contribution of nurses in today's world and what is the role of a nurse in transforming healthcare system and what is the impact of nursing autonomy in clinical setting and how the nurse can be a change agent in community health. Next slide, please. Hello. So just to have the background of this auspicious day, International Nurses Day, we should know a little bit about it and everyone knows about it, but just I would like to share once again. International Nurses Day, it is observed around the world on 12th May and it is the birth anniversary of Florence Nightingale and it is celebrated every year. And the main focus is to mark the contributions of the nurses who made the contribution to the society, significant contribution to the society. Next. Yeah. So first of all, I would like to share with you what are the contributions or the significant contribution made by Florence Nightingale. She is the pioneer of nursing, modern nursing, and she has done the contribution regarding sanitation and hygiene. It was the main point of her. And we know during the Crimean War, she used to go to the soldiers and she used to nurse them and go with the lantern in the night, and that is why she was called as a lady with the lamp. And so during this Crimean War, what she found out is she implemented rigorous standards, hygiene standards in military hospital. And what are those standards? The standards are like cleaning and disinfecting wards, okay, and promoting hand washing and ensuring access to fresh air and water also. And these are the things she felt it is very important, because she saw that after applying this significant contribution or applying these standards, there were reduced mortality rate from the infectious diseases in the military hospital. Next slide, please. Next. Yeah, she contributed in nursing education also, and everybody knows about it that she established the first school of nursing in London, that is St. Thomas, and she prepared the curriculum, with the principles of scientific principles, and she has done the training curriculum also with the what kind of best practices can be achieved or can be done by the nurses. So this curriculum is also applied whole over the world. Not today, but there are so many amendments are done. But this curriculum, initially what she set up, that was spread to whole of the society. Next slide, please. Yeah, she contributed in data analysis and epidemiology. So we know that many times when we are postgraduate student or PhD student, we struggle with data analysis. But the thing is that she is the pioneer of making data analysis, and also she established the epidemiological work also. And so particularly she documented what are the causes of illness among the soldiers and why the deaths are occurring during the Crimean War, even though care is given. So she documented all of that. Next slide. Next slide, please. Yeah, she has done advocacy for improved hospital conditions. So she has recommended the reforms in the military hospital, and she improved the sanitation and care of their social status. Next. Yeah, this is very important thing what she established, and many postgraduate students, they are learning about the nursing theory, and one of the important and prime theory is which is established by Nightingale, and she established environmental theory, and she emphasized that for the patient's recovery, only cure or medicines are only not important, but there are other things are important, like fresh air or clean air, clean water or sunlight and proper sanitation. So these are the things which are very important for the recovery of the patient. So she included and she contributed much about it, and after that, this theory only, there are many theorists who have come up and established the theory. Next slide, please. Next slide. Yeah, she elevated the standards of nursing. That means she established the curriculum for the skill practices and as well as what facts nurse needs to know. That also she raised the standard of that, and she saw that nurses are respected in the part of healthcare. Next slide, please. Next slide. She was not stuck to the hospital itself, but she contributed a lot in the community health, and beyond the hospital, she worked and she showed the importance of promoting health practices and what is the importance of health education. And how, slide please. Yeah. And this is the contribution which is done by Florence Nightingale. But today we know nurses are working in a different role. She's an administrator, she's researcher, she's educator, and she's collaborator, coordinator. All these roles she's playing. But during recent times, we have come across COVID-19 pandemic, and she took up the responsibility, and she was the front line of patient care. And many nurses have dedicated their lives during this season, and we salute them. And this is how she contributed in the today's world. And this is the just example I'm telling you. Next slide, please. Next slide. Yeah. So what we should learn from all these situations? What are the contributions made by the Florence Nightingale, and what are the contributions made by the recent nurses? We understand that nurses are indispensable. Indispensable means irreplaceable in safeguarding the health. She safeguards the health of the community as well as the patients who come to the hospital. So nursing can be described as both arts and science. You know, arts because she gives the care in artistic way, and science because everything, all the nursing is based on the scientific principle. So nursing is with the heart and mind in healthcare delivery system. So remember always, when nurses leads, healthcare follows. When the nurses are not involved in the healthcare system, the healthcare doesn't follow. Nurses don't just care for the patient, but they care for the future of health itself. And every act of nursing is an act of hope, resilience, means coping mechanism, and quite revolution in healthcare. And with their hands, nurses heals. With their vision, they transform the world of care. So we know that nurses are very prime or vital aspect in healthcare delivery system. Next slide, please. Next slide. Yeah. So we will see now what is the role of a nurse in transforming healthcare system. So we know around the world, healthcare system is at the crossroad, and we are challenged by the rising cost. The cost is increased, doctors' fees are increased, hospital stay fees is increased, aging population is there, and chronic diseases are existing still, health inequities are there, and now more than ever, there is a lingering impacts of global crisis is also there. Next slide. Next slide, please. Yeah. So in this critical moment, one truth stands clear, that nurses are not only essential to the healthcare, but we are essential. That means we nurses are essential to transform it. So the first point I would like to mention is that first point of contact. She is the person who makes the first point of contact with the patients, whether she is in the hospital, whether she is in the clinics or in the homes or in the community. So nurses are the eyes that first notices a symptom, the hands that bring comfort, and voices that reassure families. And we meet people at their most vulnerable moments and build a bridge of trust and care. So this connection is just not meaningful, it is transformational. Next slide. Next slide, please. So another point is she is able to transform the healthcare delivery system because she gives the patient-centered care. What do we know about the patient-centered care? Nurses are not only taking care physically, but they are taking care of mental health and also social health and spiritual health, all these things. So nurses, they only listen, they truly listen about their need, they understand their fear and what they hope for. So nurses, they are ensuring the healthcare is given respectfully, with dignity, according to their culture and according to their individual choices also. So nurses make healthcare more human and more responsive and ultimately more effective. Next slide. Next slide, please. So she is also a leader in the hospital as well as in the community. She is the leader in promoting the health and disease prevention. So what she do is she teaches to the community or in the hospital what is the lifestyle nutrition aspects person needs to be modified, what vaccinations are essential, how to maintain the mental health being and being preventing illness just as important as treating it. Yeah, and by keeping people healthy, nurses help to reduce. By doing that, nurses are reducing the admissions of the people to the hospital and they relieve the pressure on healthcare system. Next slide. She is the backbone of healthcare delivery system. So they lead, they change the system, whether it is in the urban hospital or the small rural also, nurses, they deliver care that keeps the community strong. Unless and until she works continuously and in the community and or in the hospital, the care cannot be delivered. What doctors do, doctors, they treat the patient, but doctors, nurses are caring for the patient. Next slide. Next slide, please. So they are innovators also. So whether it is the aspect of telehealth or in the mobile clinic, wherever they are, she is the innovator and she gives care to the undeserved people and they find the new ways to deliver care more efficiently and effectively. And innovation is not only about technology, but it is meeting real human needs in more smarter ways and more compassionate ways. Next slide. So nurses are coordinators, as I told you earlier. She is a coordinator of in the patient care. She continuously sees that the care is being delivered to the patient. So in a safe way or holistic way, especially for the patients who are living with the multiple or chronic condition, the nurse often holds their healthcare journey together. So she is with the patients all the time, and she say that she sees that the proper care is given. She's also advocate. Okay, nurses speak out against injustice, and we nurses are pushing the policies that make healthcare accessible to all, regardless of background, regardless of whatever income patient has, or wherever they stay, whatever location they are staying. Next slide, please. Next slide. Yeah. So they are helping in building the sustainable healthcare system. So it is very clear that nurses are empowered to practice to the full extent of their education and training. They are allowed to practice according to their training and according to their education, so that patient's outcome will improve and patient stays will be shortened, and also readmissions to the hospitals will be declined and satisfaction rate will be high, and overall it reduces the cost of the patient care. Yeah. Next slide, please. Yeah, so the countries who are investing, as previous speaker has told about it, the investing about the nurses, that is very important. So the countries who are investing in nursing see the reward not only in the health of the people, but also the strength of their economies. So healthier populations, if we produce the healthier population, they are more productive, more resilient, and more capable of building a better future. Next slide. Next slide, please. Next slide, please. Yeah. So, but despite all this truth, we came to know so many things nurses are doing and we know about it. But there is a painful truth that nurses are often undervalued and underrepresented. They are not at the higher levels of decision making, and they too often work without adequate support and without fair compensation. There is no fair compensation for them, and without a seat that at the table of decision making or at the table of health policy makers, she is not sitting. But many places, and even at WHO level also, nurses are sitting at that level, but many institutions it is not seen. Next slide, please. Yeah, so this must change. So how we must change? We should empower our nurses. that they are full partners in leadership. We should get involved them in the leadership and also involve them in the policy making, involve them and empower them to take more education, involve them in the research, and also involve them in the system design if we need to change. So we must invest in nursing education, expanding opportunities for advanced practice and specialization also. We must create a workplace where the nurses can voice and their voices are heard. And we must ensure that nurses' leadership is embedded in every level of health governance, from hospital boards to Ministry of Health. They should be involved in the Ministry of Health, from global organization to local communities also. And this is how we need to bring the change in our society. And we must celebrate the profound truth that nursing is not merely a profession, but she is the one who is like a catalyst for a change in healthcare delivery system. So she is very important. Next slide. Next slide, please. Yeah. So today, more than ever, we need the vision, we need the courage, we need autonomy means nurses, it refers to a nurse's ability to make independent decision about patient care within their scope of practice. So depending upon their knowledge and depending upon their experience. So it's having authority and freedom to the nurse to do the clinical judgment and to give appropriate treatment to the patient. Next slide, please. Next slide. Yeah. So when the autonomy is given to the patient, there are so many things which are happening. Those are improved patient outcome. There will be greater efficiency and cost effectiveness, higher job satisfaction and retention, innovation and practice improvement, and stronger interprofessional collaboration and expanded access to care. So next slide, improved patient outcome. Next slide.
नेक्स्ट स्लाइड
Next slide, please.
झाले इथं झाले येते लोडिंग
Yeah, improved patient outcome means when the nurse is involved or when she becomes autonomous, she can make her own clinical decisions like altering the care plan, whatever care has to be given to the patient. She can initiate some different kind of interventions, or she can advocate or give advices to the patient or promote for healthcare. They can respond more quickly and appropriately patient needs. So studies also have shown that when the nursing autonomy is given, it correlates with the lower mortality rates, fewer medical errors, and higher patient satisfaction also will be there. So that is why we need to have autonomy among the nurses. So another thing is outcome of autonomy is greater efficiency and cost effectiveness. So autonomous nurses, they can manage broader scope of care without always needing a physician. Physicians are always busy. So before the physician comes, if the protocols are there, nurses can follow that protocol, and it can reduce the delay of the patient's treatment. It will improve the workflow and makes better use of resources. So this can decrease hospital stay. This can reduce the readmission of the patient, and it lowers the overall health care costs also, which is very essential. Next slide, please. Yeah. And if the autonomy is given, there will be enhanced job satisfaction to the nurses, and they will be retained in the area. They will not go outside and try to get the job and all, but they will feel empowered, and they will get more engaged, and they will experience less burnout. Less burnout means they will not feel so much tired of working, but they will be feeling enthusiastic about it, and more likely they will remain in their same position if the position is given to them. And given the ongoing nursing shortage worldwide, we know that our nursing shortage is there. So if we foster the autonomy, they will be stabilized in the work area, and they will maintain the quality of care. So this is very important. Next slide, please. Next slide. Yeah, innovation and practice improvement. Here, autonomy is there for the nurses. They are likely to participate in the research. They will create new models. They will develop creative solutions for the clinical problem. They will be the frontline nurses to give the care to the patient with innovation, and they will enhance the better quality and safety to the patient. Next slide, please. uh, strengthened interprofessional collaboration also. She is the one, if autonomy is given, she will be, they will be recognized as authority in decision making, and they become more effective partners with the physicians, therapists, with administrators, with whom she is working, and there will be true collaboration. And this is not collaboration I am speaking about hierarchical, but it leads to more comprehensive and patient-centered care. Next slide.
केले
Next slide, please. Yeah, expanded access to care. So in many settings, nurses, practitioners and advanced practice nurses, they are operating with full autonomy, extend primary care services to undeserved areas also. Their independent role elevates the shortage and increases the community access to essential health services. Next slide. Yeah, we will see now the nurse is as a change agent in healthcare system, community health. So nurses, they drive community health change by acting as change agent, educator, advocates, and collaborators. Next slide. Next slide, please. So what is changed agent? We will see about it. So nurses can identify the problem, and she can improve the community health outcome also. She can involve the family members, and along with them, she can solve the problems in a more creative way, and she can bring the changes in a healthcare system. And this can be involved. She can develop a new program, or she can adapt existing ones to meet specific community needs, or advocating some policy changes and support the health equity, means healthcare to everyone in a same level. Next slide. Next slide, please. About the educators, she can educate the community and do the counseling. She can conduct the group sessions. She can conduct the workshop. She can have the community outreach program also. And this will include the providing information, various health topics, and she can promote healthy behavior, empower the individuals to make informed decisions about their health. So she can educate to the community in more effective way. Next slide. Next slide, please. Yeah, she is an advocate. So nurses act as an advocate for the rights and needs of the individual and communities. Okay, and this includes working with policymakers. She can work with the policymakers, community organization, other stakeholders, and she will address the issues. And she is advocating. She will advocate about the poverty, lack of access to healthcare, and discrimination to the authority. Next slide, please. Yeah, she can be a collaborator, and she can collaboratively work with other healthcare professionals, community organization. They can build partnership with the schools and the churches, community care centers, and other organizations to reach and raise intervention that address the complex social and environmental factors which influences the health. Next slide, please. Next slide, please. So research has shown that investment in nursing leads to healthier population. So we need to invest in nursing profession. It will reduce hospital admission, it will reduce shorter recovery times and more efficient health systems. We know that every dollar or every rupees which is invested in nursing, it will generate multiple dollars or multiple rupees in return through increased productivity of a person, better health outcomes, lower healthcare costs, and far too we can see as a cost rather than cornerstone. Next slide. Yeah, so the future of healthcare depends on how the world sees or values and support nurses. That means fair wages should be given to them, safe working conditions must be there, access to the education and professional development, and seats at the table for decision making. It means recognizing that care is not the charity which is given by nurses, but it is strategic investment. So the future is calling for transformation, and as we face aging population and certain rising chronic conditions are there, diseases are there, global pandemic and also health disparities are there, nurses are uniquely positioned to it. So nursing profession is the cornerstone of healthcare delivery system. So today, as we celebrate our profession, let us also raise our voices. Let us advocate for policies that empower nurses. Let us demand recognition, not in words, but in resources. Let us continue to lead, to inspire, and to care, not just for our patients, but for the future of healthcare itself. Next slide. So we should be empowered. So to every nurse who is here, sitting here, and around the world, thank you for your courage, what you have contributed a lot, your skill, your heart, and your power. Happy International Day, and I should say the theme is very appropriate that our nurses, our future, caring for nurses strengthens economies. That means our nurses, they create a bright future, and if we care for these nurses, it strengthens the economies. Thank you very much.
Thank you so much, ma'am, for your enriching and inspiring session. You have beautifully highlighted the significant contribution of nurses in today's evolving healthcare landscape. Your insights into the vital role of nurses in transforming the healthcare system, the importance of nursing autonomy in clinical practice, and the empowering role of nurses as change agents in the community have truly broadened our perspective. The way you highlighted the role of nurses as the backbone of the healthcare system, the importance of compassionate care, and the power of knowledge and continuous learning was not only motivating but deeply moving. Your words remind us of the immense responsibility we carry and the powerful impact we can make in society. Truly grateful for your guidance and inspiration. Once again, thank you so much, ma'am, for sharing your valuable time and knowledge with us. If any participants have questions for, so kindly type them
Yes.
on chat box or ask them.
Okay.
Okay.
Once again,
Thank you so much, ma'am.
Thank you once again.
Okay,
Thank you. Thank you.
So, it is now my pleasure to introduce our next distinguished speaker, Dr. Dayanand Belgavi sir, a respected nurse educator, researcher, and international clinical expert. Sir hold a PhD in nursing, a master in pediatric nursing, and an MBA in hospital management with 15 years of experience. Dr. Belgavi sir currently works as a registered nurse in the medical ward at Borders General Hospital, Melrose, Scotland, UK. Sir has authored 22 research publications that contribute to the advancement of nursing science. Sir has guided 8 postgraduate and 12 undergraduate students through their research project, fostering co-supervised 2 PhD nursing scholars, supporting their journey towards doctoral completion. Sir has evaluated 2 PhD theses, ensuring rigorous academic standard and scholarly excellence. Sir served as a member of doctoral research committee for 2 universities, contributing to high-level research governance and policy. Dr. Belgavi sir has worked as a lecturer at Havasa University, Ethiopia, and as a band 5 nurse at Worthing Hospital, UK. Sir has published a book, presented at 5 national international conferences, and attended over 54 faculty development programs. Sir has also a respected journal reviewer and resource person. Sir, we are honored by your presence and are eager to hear your thoughts. So, sir, please take over the session. Sir?
कॅमेरा माईक आले आले आले.
Hello, can you hear me?
Yes, sir.
Yes, sir.
Okay, good afternoon to everyone. As you introduced about me, and I'm Anand Belgavi. I'm very thankful to you for my introduction, Bhagyashree, and I would like to thank the Dr. Milind Kale sir for allowing me, giving me an opportunity to give a webinar in this session. Also, I would like to thank all the organizing secretaries, Neha Patil, Prince Minister, and all the Lisa sir and Shubha sir, all the faculty, MET College of Nursing, for giving me the opportunity to have an webinar in this session. So, uh, straight away, I will start with the session. It is a very short and brief, as the two sessions you have held already regarding the nurse, regarding the
Excuse me,
nurses.
sir.
Hello.
Sir, your voice are breaking, sir.
इन्स्टॉल करून आपल्याला
Hello, can you hear me now?
Yes, sir. Audio is clear, sir.
Okay, I'll straight away start with my topic. Can you put in the slides, please? Have you got my slides, please?
Sir. I can share your slides, sir. Wait a minute, sir.
Next slide, please. So here, main objective of this session is like to understand the various different values of the professional in nursing practice, in order to have our to achieve the health promotion in our settings, wherever in the clinical or community or educational settings. So we have different various professional values. We need to understand. We know that we have some inner character in among ourselves, such as what we behave and what we learn from our ancestors and from our parents and all everybody. So we may not be everybody individual. It's a different individual peoples. So all are not the same, as you know. So if somebody is having some values in their mind, and they come into the nursing, and some people they have different values, they will come into the nursing field. So all together, we cannot make or create much more different values, which will we can incorporate with those values of the nursings, as they said. But as the practice goes in their life, or when they experience much more experiences in their practices or in the nursing, day by day they can learn, and then they can incorporate in our nursing field. So different values are there for everybody, human beings. So as some of the professional values, as you know, sir, as you know, the founder of the nursing is Florence Nightingale. She, during the 18th mid-century, she has given some of the some standards or ethics to the nursing to follow. So we have during those centuries, she has given some of the values and ethics. So those values and ethics we are still studying, and everybody we are still giving a more importance for those values. It means that she has some discovered or identified some of the values importance of those, and then she has given to all our world, all the world nurses people to follow those values. So that's why it's very important to have to know about these values. Can you share the next slide, please? So we know the nurses who understand how the patient's values and their own values shape nurse-patient interactions. So it's not the only the interactions with the nurse-patient. So we are interacting with the teachers, we are interacting with the parents, we are interacting with the community, family members, and so the interactions what we that it will help to make a build a very much the build those values into our settings, and who continually develop sensitivity to the ethical dimensions of nursing practice are best able to provide quality care and advocate for their patients. So we if we know some values, then only we can help the patients, and we can advise the patients regarding any kind of the health care in order to promote their health in a proper well-being. So they can they can be free from the from their illness and improve their health. So with various examples I can tell, because of the in order to, if we give a proper exercise, give them proper mobility exercise, uh, they can be able to move, means like they can be able to walk day by day. Some of the patients they are very poor in mobility, so we can help them to move day by day some exercises, and that will help for their health promotion for the patient. That's what we have to have values to understand our standards, what our characters are there. Main, we need to know the characters of the what we are doing actually the right thing, whether we are doing a right thing or no. And uh, the nurses the health promotion of the patients, it depends on the nurses values. We need to understand the patient's needs, what their actual need is there, and then prioritize the needs. So we have to have a proper what I mean that we need to get a proper standards, or is our characters should be there. Main the character, what our character is there, it depends on the our character, the health promotional activities we can provide. Next slide, please.
झालं की नाही? केली. इथं
So
लिहिलं.
values are during beliefs. What is value? You can see that values are during beliefs or attitudes about worth of person. So it's how much importance of the person, or object, idea, or action. Values are important because they influence decisions and actions, including nurses' ethical decision making. So here I said you what we are doing in a clinical practice, what we are doing day by day today is that we have various tasks
करणार मी काय? पण
and
काय माहिती
various
घेतलं.
works are there, and we need to complete those tasks, or we may face many problems.
मोबाईलवर बसले.
So as I'm working here now in UK, so we are having so many decision making things are there. We may not be right decision, but it is everybody. Human beings are not right. They will not be a right, and some point you need to have a proper decision making. I cannot say it's 100% decision making. Something will be wrong. Also, that's a practice for us. So when we have a when we do a proper decision making, we cannot say it's 100%. So even though we try to do take that task and achieve those tasks depend on the what action you want to do. For example, in your community settings, you may be planned like a health care, health education to the mass public. So for to conduct that health education, it's one kind of the health promotion. So there is various what you call actions are there. So various works are there. So how you are delegating the work, how we are achieving the health promotion education in your community settings, it depends on how we are all gathering and making a decision. Some point somebody will be right, at some point somebody will be wrong. So proper it depends on your values, how your inner values are there to make the proper decision making, uh, that and also to carry out their actions. So that's what I given more importance for the values of the nurses here. Next slide, please.
यही देखो
Next is like the responsibilities of the nurses in health promotion. We are all knowing our responsibilities. So just we are just summarizing those responsibilities of the nurses in order to promote the health of the patients. Assessing the health needs is the first point which I have added. Here, the nurses should assess the health needs of the individuals or the public and provide them with information and education. So, again, the education comes. So, education means here there are lots of educations. So, you need to find out what kind of education you need to give to the public. So, for example, before giving before giving an education topic, we need to find the topic, what kind of topic you want. Before that topic, you need to research the what kind of topic you want to find, you want to give to the your area, because in your area maybe there is a occupational health hazards is a 85% or 90% problems are there, or any pollutions, or what kind of or any people are more smoking, you want to give a smoking session education topics. So that topics you can decide any do the research properly and then find out the education, what kind of need you want to give, assess the health needs of the patients. That's in the community settings. When you come to the hospital, where the patients have all the physiological needs, you need to find out the basic foundation physiological needs, hierarchy of the needs. So depend on the needs, you need to provide the main so different hospital, like different wards, there are different needs of the patients are there. So like ortho, there is different kinds of needs like mobility and physical, and in respiratory, then there kind of the respiratory needs are there. And so you need to find out what kind of education you want to give to which particular areas, enable them to promote the health, assume self-care at different stages of their lives, and to cope with the acquired and chronic illness and injuries. So